How is it possible that thousands of people every single day walk around feeling a little pressure in their chest, a weird tightness in their arm, maybe a strange wave of fatigue, and they simply shrug it off like it's nothing? Seriously, think about that for a second. How can something as deadly as a heart attack start so quietly that people ignore it, laugh it off, or tell themselves, "Nah, I'm probably fine"? And here's the scary part. Doctors say the number one deadly mistake people make before a heart attack isn't bad food. It isn't stress. It isn't even aging. It's ignoring the early warning signs. Yeah, ignoring them. Brushing them aside like they're just another annoying ache from getting older. Now imagine this. It's a normal Tuesday morning. A guy named Robert, 67 years old, wakes up feeling a little off. Nothing crazy, just tired. Like he didn't sleep well. His chest feels tight but not painful, just uncomfortable. Like someone's pressing lightly on it. He sits at the kitchen table sipping coffee, staring out the window, telling his wife, must be indigestion." She looks at him a little concerned, but Robert waves it off with a half smile. "Relax, honey. I'm good. Just getting old, I guess. Sound familiar?" That exact moment, that decision to ignore the body, that's where the danger begins. Because what most people don't realize is that heart attacks rarely explode out of nowhere, like they do in movies. Nope. In real life, they whisper first. Quiet signals. Subtle changes. Fatigue that feels strange. A dull ache in the jaw. Pressure in the chest. Sometimes even pain in the back or shoulder. And the body is basically screaming, "Hey, something is wrong here." But people ignore it. Why? Because they don't want to believe it. They convince themselves it's heartburn, muscle soreness, stress, anything except the truth. And doctors say this mistake is killing thousands of older adults every single day. See, as we age, our bodies change. The heart becomes more vulnerable. Arteries stiffen. Blood flow can slow. But here's the crazy part. Many of the medical treatments people trust the most can actually make the situation worse if used the wrong way. Yep, that's the part nobody talks about. Some treatments that seem harmless, even routine, can become dangerous for aging patients when doctors don't adjust them properly. Blood pressure medications that lower pressure too much. Painkillers that strain the heart. Certain procedures that older bodies simply can't recover from the way younger bodies do. And suddenly, a treatment meant to help becomes something that quietly increases the risk of a deadly heart event. Now don't get me wrong, medicine saves millions of lives. No question about that. But medicine isn't one size fits all. Especially not after 60. Especially not after 70. Doctors themselves are starting to say something shocking. Some treatments older adults receive every day are outdated, overused, or simply too aggressive for aging bodies. Yet they're still being done, still prescribed, still trusted blindly. And here's where things get emotional. Because most patients assume the system always knows best. They trust the white coat. They trust the prescription bottle. They trust the hospital room lights glowing overhead at 3 a.m. But sometimes, the most powerful protection you have isn't a machine or a medication. It's awareness. Awareness of your own body. Awareness of warning signs. Awareness that something just doesn't feel right. Let's go back to Robert for a moment. Sitting there at the kitchen table, coffee getting cold. That pressure in his chest still hanging around like a quiet shadow. He stands up slowly, walks toward the living room, and suddenly the tightness spreads into his shoulder, into his jaw. Now he pauses. Breath gets shorter. A weird dizziness creeps in. But guess what he does? He laughs it off again. "Man, Must have been that spicy chili last night. And he waits. 10 minutes pass. Then 20. That delay, that tiny decision to wait, is the mistake cardiologists say costs lives every single day. Because during a heart attack, every minute matters. Literally every minute. Blood flow to the heart muscle is being blocked. Cells are starving for oxygen. Damage is building second by second. But the earlier treatment begins, the more heart muscle doctors can save. Wait too long, and the damage becomes permanent. Now here's the twist most people don't know. Heart attacks don't always feel dramatic, especially in older adults. Sometimes there's no crushing pain. Instead, it feels like exhaustion, nausea, sweating, a strange discomfort in the upper body. Some people even feel like they have the flu. Crazy, right? A life-threatening event disguised as something ordinary. And that's why so many people misjudge it. They delay calling for help. They delay going to the hospital. They delay telling family members. And delay is the silent killer here. Doctors sometimes call it the golden hour, the first hour after symptoms start. If treatment begins during that window, survival rates skyrocket. But if people wait 3, 4, 5 hours, the heart muscle may already be severely damaged. That's the tragedy. Not lack of technology, not lack of medicine, just lack of awareness. And let me ask you something real quick. Have you ever ignored a strange symptom because you didn't want to seem dramatic? Be honest, a lot of people do. Drop a comment and say, "I've done that," if you know exactly what I'm talking about. Because sharing these stories might actually save someone else's life. No joke. Now here's something else shocking cardiologists reveal. The number one phrase heart attack survivors say after recovery is this: "I wish I had gone to the hospital sooner." Almost every single one says it. They look back and realize the signs were there. They just didn't recognize them, or they didn't take them seriously. But the body almost always gives a warning. The problem is people are too busy, too proud, or too uncertain to listen. And that's exactly why this conversation matters. Because the difference between survival and tragedy can sometimes come down to one decision: picking up the phone and calling for help. Not tomorrow, not later, right now. Now here's where the story gets even more surprising. Because that deadly mistake of ignoring symptoms isn't the only thing putting aging patients at risk. Doctors are also starting to speak up about certain medical treatments that older adults should approach with caution. Treatments that once seemed routine, but can quietly increase heart stress when the body becomes more fragile with age. One cardiologist in Chicago explained it like this: "The human body after 60 isn't the same machine it was at 30. You can't push it the same way." Yet many treatments still follow aggressive protocols designed decades ago. Strong medications, heavy sedation, complex procedures. Sometimes the benefits outweigh the risks, but sometimes they don't. And the heartbreaking part is patients rarely know the difference. They assume more treatment automatically means better treatment. But sometimes the safest move is actually slowing down and asking questions. Real questions. Like, is this procedure necessary right now? Are there safer alternatives for someone my age? What happens if we monitor the condition instead? These conversations are happening more often now because medicine is evolving. Doctors are realizing that longevity isn't just about extending life. It's about protecting quality of life and avoiding unnecessary risks. And that's where knowledge becomes power. Imagine an older patient walking into a clinic feeling confident enough to ask thoughtful questions, not challenging the doctor, just being part of the decision. That simple shift can prevent dangerous overtreatment. It can prevent complications. Sometimes it even prevents heart strain that might trigger a cardiac emergency. Pretty powerful stuff, right? But let's bring this back to something personal. Think about someone you love. Maybe a parent. Maybe a grandparent. Maybe even yourself years from now. Would you want them ignoring warning signs because they think it's no big deal? Would you want them accepting every treatment automatically without understanding the risks? Of course not. You'd want them informed, aware, protected, and that's exactly why conversations like this matter. They spread awareness that could literally save lives. So if you're watching this right now, and something in this story resonates with you, share it. Send it to someone you care about. Because one piece of information at the right moment can change everything. And remember Robert from earlier? The man sitting at the kitchen table ignoring that strange chest pressure? Eventually, his wife insisted they go to the hospital. He didn't want to. Said it was a waste of time. But she pushed. Thank goodness she did. Doctors discovered he was having the early stages of a heart attack. Treatment started immediately. Blood flow restored. Heart muscle saved. Later that night, Robert sat quietly in his hospital bed, staring at the heart monitor beeping beside him. And he whispered something to his wife that she'd never forget. You saved my life today. Not the machines. Not the hospital. Her decision to act quickly. Her refusal to ignore the signs. And that's the lesson here. Sometimes survival isn't about advanced technology. It's about recognizing the moment when your body asks for help and responding without hesitation. So before we end this conversation, here's a simple question I want you to think about. If your body sent you a warning signal tonight, would you listen? Or would you brush it off like so many people do? Your answer to that question might matter more than you realize. So here is the suggestion. If you ever experience chest pressure, sudden fatigue, shortness of breath, jaw pain, arm discomfort, dizziness, or unusual sweating, especially after age 60, do not ignore it. Call emergency services or go to the hospital immediately. It's always better to be safe than sorry. Also talk openly with your doctor about medications and treatments you receive. Ask questions about risks and stay informed about your heart health. Awareness, quick action, and communication with healthcare professionals can save your life.